Low-level laser therapy. New concepts for human disease response. Photobiomodulation therapy. Why do people get sick? Everyone will inevitably get sick. What is the reason? The human body is composed of trillions of cells that make up various tissues and organs, and performs over 200 different functions in different types. The human body absorbs various nutrients and energy every day. At the same time, the physiological waste generated after use is discharged. To finish a complete system cycle and maintain the normal functioning of tissues and organs. However, once bacteria or viruses invade the human body, causing tissue or organ damage, or due to cell aging, rendering it unable to perform its intended function, the human body will suffer from illness. Severe cases may endanger life. How to deal with illness? Traditional medicine as approach to disease, usually used with medication, to kill harmful bacteria or viruses, or remove some of the organs of the human body that have lost their function, make the lesions no longer harmful to the human body, and let the patient's life continue to be maintained. Although this method of treating diseases can be effective immediately, but it may also have many side effects. The effect on some functional disorders caused by aging is not very significant also. Therefore, in recent years, scientists have been committed to finding more effective medical treatments without side effects. Photobiomodulation therapy is one of them. What is photobiomodulation therapy? The human body already has a complete immune system, a powerful force composed of immune cells with various functions, to fight against any bacteria or viruses that invade the human body. However, the emergence of disease means that this immune team was defeated in the process of resistance. The reason is due to insufficient production of immune cells and insufficient energy provided to immune cells. Just like even a powerful army will be defeated due to lack of food and grass. Photobiomodulation therapy is the stimulation response through photons. Stimulate cellular photochemical reactions to enhance the functions of various cells. Not only can it enhance the resistance to the attack of foreign germs, it can also restore damaged cell functions. What effect does light have on human cells? Research by Harvard scholars shows that the stimulation of light in the body can activate the mitochondria of cells and immediately synthesize a large amount of adenosine triphosphate, ATP for short. To provide body energy, simultaneously releases nitric oxide, dilate blood vessels and promote angiogenesis, improve microcirculation and relax myofascia, relieves neuralgia, fibromyalgia, sore shoulders, pain from joint disease, and promote wound healing. In 1903, Professor Niels Ryberg Finsen of Denmark uses light waves to treat skin diseases. Prove that light has a positive therapeutic effect on biological cells. Not only won the Nobel Prize, also started research on phototherapy. Mechanism of photobiomodulation. When human cells are exposed to light with a wavelength of 600 to 800 nanometers, cytochrome oxidase in the mitochondria releases nitric oxide, thereby increasing the production of adenosine triphosphate. When human cells are exposed to light with a wavelength of 800 to 1000 nanometers, will cause the cell membrane to open ion channels. Let calcium ions from outside the cell enter the inside of the cell. Modulated response via activated cells. Promote the generation of adenosine triphosphate and reactive oxygen species. Adenosine triphosphate is an intracellular energy transfer substance with the function of storing and transferring chemical energy. Can help move proteins and fats in and out of cells. In the central nervous system, it regulates neurodevelopment. It also plays a great role in muscle contraction. And adenosine from adenosine triphosphate is also a component of RNA. When the mitochondrial ATP is produced, it can improve the migration ability, attachment ability, and contraction ability of cells. Enhance wound healing and muscle strength improvement. The generation of reactive oxygen species. Can synthesize specific proteins. Stimulate secretion of growth factors. These substances play a large role in the secondary effect. Initiate repair-related mechanisms with secondary messengers. And enhance antioxidant response. This is a secondary level effect. The third level effect is the activation of gene expression. Synthesis of specific proteins to regulate cell function. The fourth level effect is repair factors, stem cells, etc., produced in the secondary or third level are transported to the remote site through the blood circulation. Modulates remote cell function. Photobiomodulation therapy and autonomic nervous system disorders. Red or near-infrared light stimulates photochemical reactions in cells, is the most effective photobiomodulation mode. It can be used to promote cell vitality, regulate physiological functions, or repair tissue damage. Autonomic nervous system is the nervous system that regulates the activity of internal organs, smooth muscles, and glands. It is not controlled by consciousness and has a certain degree of autonomy. When the autonomic nervous system is imbalanced, it may cause mental uneasiness and anxiety, insufficient concentration and memory loss, insomnia, drowsiness, sleep disorders, decreased appetite, dampness, and heat all over the body, easily tired, headache, dizziness, eye fatigue, dryness, blurred vision, tinnitus, ear tightness, dry mouth, abnormal taste, throat discomfort, foreign body sensation, chest tightness, difficulty breathing, palpitations, constipation, diarrhea, gas, stomach cramps, nausea, muscle weakness, joint pain, chronic fatigue, shoulder and neck tightness, skin tingling, itching, flushing, cold fingers, sweaty palms and soles, frequent urination, impotence, physical discomfort, itching of the vulva. Common causes of autonomic nervous system disorders include Psychological stress imbalance of neuroelectric activity. Neuropathies, secondary diseases derived from chronic diseases. Traditional treatment methods include taking tranquilizers, antidepressants, sleeping pills, and other drugs. However, it may often be accompanied by discomfort corresponding to side effects. Photobiomodulation therapy provides another effective treatment without any side effects. How photobiomodulation therapy improves autonomic dysregulation. Photobiomodulation therapy promotes a large amount of ATP production, which can enhance skeletal muscle contraction and improve fatigue and weakness. ATP also affects cell electrical activity and improves cell vitality. The trace amount of nitric oxide released during the photobiomodulation process. It acts as a message conduction molecule, improves microcirculation, reduces cardiovascular load, and improves erectile function. The secondary effect of photobiomodulation can reduce or eliminate toxic substances such as beta starch in neural tissue, conducive to the restoration of axonal or dendritic extension of the cell body. Affects the related repair functions of mesenchymal stem cells to promote nerve repair. It can also promote the repair of body tissues and internal organs, improve organ lesions, and by changing the intestinal flora. It affects the gut-brain axis, adjusts brain activity, and improves depression, insomnia, and neuropathy. In short, through trace amounts of nitric oxide, reactive oxygen species, large amounts of adenosine triphosphate, and cyclic adenosine monophosphate, photobiomodulation promotes angiogenesis, cell growth, cell migration, tissue remodeling, and other effects, has been considered as an important tool for tissue engineering or cell therapy. How to perform photobiomodulation therapy. Growing evidence shows the surprising health benefits of photobiomodulation treatments. Clinical studies are also beginning to explore the various potentials of red and near-infrared ray therapy, and used to cure a variety of physical and mental illnesses. Basically, what is called light means the visible light that our eyes can see. Visible light is just one of many electromagnetic waves of different frequencies. The wavelength of visible light to the human eye is between 380 to 780 nanometer. Wavelengths shorter than 380 nanometer are called ultraviolet light. Wavelengths longer than 780 nanometer are called infrared ray. Among them, visible red light with a wavelength between 630 to 700 nanometer is the ideal wavelength to penetrate skin cells and sebaceous glands. It can smooth fine lines, promote collagen production, and rejuvenate the skin. Near-infrared rays with wavelengths between 700 to 1100 nanometer can penetrate deep into tissues, provides energy to the body's cells, and can travel through bones to help heal deep wounds and muscle pain, nerve damage, or joint pain. Further clinical research finds that near-infrared rays can help reduce headaches, anxiety, sleep disorders, and cognitive impairment. The specific effects of low-level Lase therapy LLLT. Reduce the side effects of cancer treatment. LLLT can enhance human immunity and accelerate cell proliferation, so it can alleviate discomfort during cancer treatment. Some studies show LLLT can destroy certain tumors and enhance cancer treatment. In 2018, a group of Harvard academics examined the evidence that LLLT could benefit or harm cancer patients. The conclusion is that while there are several papers suggesting that photobiotherapy may be harmful in experimental animals with tumors, there are also many articles suggesting the opposite. It is believed that light can directly destroy tumors and stimulate the host's immune system, can be treated with other cancer therapies. In 2020, a group of European and American scholars reviewed 67 papers on the impact or survival rate of LLLT therapy on cell proliferation, differentiation, tumor growth, and recurrence. Conclusion is that LLLT is safe for cancer patients and has real advantages in preventing and treating certain cancer-related complications. Used in obstetrics and gynecology treatment. LLLT can increase prolactin and breast milk. Korean study shows LLLT effectively relieves menstrual pain. Saudi Arabian research shows LLLT is as effective as high-energy pulsed laser in relieving menstrual pain. Chinese study shows LLLT is as effective as birth control pills in relieving menstrual pain. Iran study shows when LLLT is used for analgesia after caesarean section, it may be able to reduce subjective pain, prolong the first request for analgesics, and reduce the amount of analgesia. May relieve breast cancer-related lymphedema. Approximately 3.2 million women were diagnosed with breast cancer in 2020, resulting in approximately 685,000 deaths. About 82% of patients in developed countries survive for more than 10 years. About 1/5 of breast cancer patients suffer from lymphedema. LLLT may alleviate breast cancer-related lymphedema, effectively relieve pain and scars after surgery. Post-surgical pain market value in 2017 was $12.4 billion. The compound annual growth rate from 2018 to 2026 is 4.4%. Israeli scholars review 124 research reports from 2003 to 2017. The conclusion is, using laser therapy to promote postoperative wound healing is safe and effective. Recommended to reduce pathological scars. However, general laser therapy machines are expensive and heavy. There are certain risks when using only low-energy semiconductor laser therapy machines, effective and safe. Available without a physician's prescription in the United States. No need for doctor operation. Effectively relieve pain and scars after surgery. Post-surgical pain market value in 2017 was US $12.4 billion. The compound annual growth rate from 2018 to 2026 is 4.4%. Israeli scholars review 124 research reports from 2003 to 2017. The conclusion is, using laser therapy to promote postoperative wound healing is safe and effective. Recommended to reduce pathological scars. However, general laser therapy machines are expensive and heavy. There are certain risks when using only low-energy semiconductor laser therapy machines. Effective and safe. Available without a physician's prescription in the United States. No need for doctor operation. Effectively relieves plantar fasciitis. According to statistics, 4 to 7% of the general population suffers from heel pain. About 80% of them are plantar fasciitis. Plantar fasciitis can be reduced if LLLT is administered. Effectiveness lasts 3 months. Effectively relieves carpal tunnel syndrome. According to the literature, LLLT therapy is used to treat carpal tunnel syndrome. The effect is the same as ultrasound. And ultrasound requires hand holding and contact. LLLT treatment does not require. May relieve pain from knee arthritis. According to statistics, 13% of women and 10% of men over the age of 60 in the United States suffer from knee osteoarthritis. Recent research proves LLLT is effective in a variety of musculoskeletal pain disorders, such as tendinitis in the neck or lower back, especially the Achilles tendon, epicondylitis, chronic arthritis. LLLT also has preventive capabilities, can enhance muscle strength and accelerate muscle regeneration. Therefore, as a method of treatment and prevention of various acute and chronic musculoskeletal diseases, LLLT has the potential to be effective, non-invasive, safe, and have a high price-to-earning ratio. Approximately 1% of the U.S. population suffers from rheumatoid arthritis. The standard of treatment for most inflammatory diseases is immunosuppressants. For example, corticosteroids with adverse toxicity. LLLT regulates the immune system of the skin and joints. Can be effective in humans by affecting bacterial colonization. Reduce fracture pain and improve healing. Iranian doctors recruit 54 patients with tibia fractures. A double-blind trial was conducted in 2 groups. Results: the vast pain sensation and analgesic consumption within 24 hours in the LLLT treatment group were significantly lower than those in the control group. Another 50 patients with wrist and hand fractures were randomized into clinical trials. The LLLT treatment group received irradiation 5 times per week. Continue for 2 weeks and follow up for another 2 weeks. Results were significantly better than controls in pain disability, grip strength, and X-rays. Promote wound healing. LLLT can promote healing of third-degree burns on amputated feet in diabetic patients. According to the literature, 10 diabetic patients who had their feet amputated and suffered third-degree burns during autologous skin grafting. Collagen mother cells are extracted and cultured in vitro for 3 to 4 weeks and administered LLLT treatment 10 times. Red light illuminates the ulcer area and infrared ray illuminates the edge. The wounds of all 10 patients healed after 10 to 12 weeks. Israeli scholars review 124 research reports from 2003 to 2017. Draw the following conclusions. Using laser therapy to promote postoperative wound healing is safe and effective. Recommended to reduce pathological scars. Improve cranial neuropathy. LLLT can penetrate the skull. Enhance ATP biosynthesis in brain nerve cells. Regulate mitochondrial homeostasis. Promote neurogenesis and neuroplasticity. Can be used to treat depression and Alzheimer's disease. Harvard Medical School recruited 15 subjects average age 14 to 30 to learn about alternative treatments for anxiety disorders. 12 of them completed the near-infrared transcranial photobiomodulation test. Results showed a significant reduction in overall clinical severity in the Hamilton Anxiety Scale total score. Significant improvement in sleep quality index, and no serious adverse events. 12 veterans diagnosed with chronic trauma over 18 months old were treated with pulsed transcranial photobiomodulation 3 times per week for 6 weeks. The results showed a significant increase in neuropsychological scores and regional cerebral blood flow. In addition, China Medical University random grouping in 2021. Infrared ray therapy 18 times, every week 3 times. Effective treatment of facial paralysis. Improve skin inflammation. By improving the immune system, LLLT can effectively relieve atopic dermatitis and lupus erythematosus. Recruit 19 subjects based on literature records. Irradiate 4 to 14 times with red light and infrared ray. The affected area of the same subject is divided into 2 areas. One area received LLLT treatment and the other area received sham treatment. The result was a greater improvement in the LLLT treatment group. LLLT treatment can also improve white stretch marks. Moreover, red light with a wavelength of 660 nanometers is more effective than ultra-red light with a wavelength of 830 nanometers. Make infertility better. Male testosterone concentrations naturally begin to decline after the age of 30. Men can gain sexual excitement and satisfaction through LLLT. Natural improvements in fertility and physical performance. Because red light and near-infrared ray can stimulate photoreceptor proteins in the testicles, resulting in higher testosterone production. LLLT treatment in 20 men with oligospermia aged 29 to 43 years. Twice a week 4 minutes each time, after a total of 10 times. 15 of them had increased sexual desire. At the same time, sperm quality was significantly improved. Increased sperm activity and total number. Abnormal sperm count. Scholars from Harvard and Massachusetts General Hospital have used transcranial devices. Improve sexual dysfunction of patients. Japanese scholars studied 74 women with severe infertility, average age 39 years old, from 1996 to 2000. Apply LLLT treatment, wavelengths 830 nanometers, 60 milliwatt. Twice a week, an average of 21 treatments. The study was subsequently extended to March 2012. A total of 701 patient records were eventually collected. The results show that among 74 people in the first part, 16 patients successfully became pregnant, success rate 21.7%. The results of all 701 people tested, 156 people successfully became pregnant, success rate 22.3%. 79 people gave birth successfully, success rate 50.1%. Another study of 400 infertile women in Denmark and Norway. After hormone IVF, in vitro fertilization, and ICSI stem cell transcription cycle treatment, aged between 30 and 30 years old, 1 to 3 months of LLLT treatment, illuminating the abdomen with large area of red light and infrared ray, 6 times in 2 weeks, 23 minutes each time. As a result, 66% were successful in getting pregnant. The oldest pregnant woman is 50 years old. Weight loss and fat loss. LLLT therapy not only makes the body more energetic. Researchers also found that LLLT affects fat cells, causes dispersion of lipids. In other words, LLLT therapy helps the body get rid of fat cells. It is a safe, natural option with no side effects. Can make your figure better and healthier. Prevent hair loss and stimulate hair growth. Hair loss is a common disease. There are few proven effective treatments. However, research shows LLLT therapy can stimulate hair growth. Red light wavelengths have been recognized to stimulate epidermal stem cells in hair follicles. Move hair follicles to the anagen phase. Help sleep. Red light is a powerful sleep promoter, a sharp contrast to the green light. There is evidence that red light with a wavelength of 600 to 900 nanometers induces the production of melatonin in the body. Melatonin is a sleep-inducing hormone. It is the ultimate sleep aid. Its secretion output can be increased under the irradiation of red light, thereby extending sleep time, improve sleep quality, adjust the sleep cycle, reduce training and recovery time after injury. For high-frequency performance athletes, LLLT treatment can help accelerate muscle repair after fatigue and injury. Mitochondria within cells are particularly sensitive to LLLT treatment because muscle cells are particularly rich in mitochondria. In addition, LLLT treatment can stimulate stem cells, further aids muscle recovery, may make skin look healthier and plumper. LLLT treatment significantly helps improve skin condition. The red light wavelength specifically targets the mitochondrial chromophores within skin cells to produce collagen. Compared to just remodeling the outer layer of the skin, collagen stimulation produces more comprehensive and lasting benefits to the skin. Stem cells can also be activated to increase tissue repair. Not only accelerates healing and wound repair, improves the appearance of hypertrophic scars, reduce fine lines and wrinkles. It can also tighten skin and improve skin texture. The difference between laser light and LED light. The earliest photobiomodulated light source was the arc lamp. Later it will be changed to LED. These two light sources easily generate heat and cannot be used at high power. The amount of light available to the cells is low. Photobiomodulation effect is also weak. With the advancement of science and technology, has been gradually replaced by high-energy single-wavelength red light or near-infrared laser. LED photoelectric conversion efficiency is much lower than laser. Under the same power, LED emit far fewer photons than lasers, and LED is not a single light wavelength. Highly thermogenic in human tissues. To avoid heat damage, LEDs mostly work with low energy. Only a small number of photons can be provided to act on shallow tissues. The effect is more limited. Laser is a single wavelength light source. Low thermogenesis in tissues. Can be used with high energy. Laser provides a large number of photons that not only act on superficial tissues. There are also enough photons to penetrate deep into deep tissues such as muscles, blood vessels, and nerves. Can act on deep human tissues. What is a good LLLT therapy device? Low-level laser therapy. A good low-power laser therapy device must have light irradiation with wavelengths of 660 nanometers and 980 nanometers. Using gallium arsenide semiconductor laser as photobiomodulation light source to provide enough energy. And defocused light does not harm human tissue. Extra large irradiation area. Provide more efficient actions. Compact mechanical structure. Break through the limitations of space. Provide convenience for remote use. Design of multidirectional mechanical joints. Can be flexibly used on every part of the body. All in all, a powerful LLLT therapy device. Should be easy to use. Can provide efficient, effective, and low-cost treatment. It will play an important and non-negligible role in the future medical field.